Patient height and BMI have long been the measuring tools for intra-aortic balloon catheter sizing selection. However, recent studies have shown poor correlation for aortic length to height. While a larger balloon size may increase augmentation, it does not come without potential risks. These risks include, among others, balloon rupture, thrombocytopenia, hemolysis, compromised organ perfusion. The goal is for the intra-aortic balloon to be 90 to 95% occlusive of the descending thoracic aorta. To assess the occlusivity of the balloon within the aortic space, first lower the cursor using the arrow keys on the right side of the monitor. Once the cursor turns blue, it is now in the balloon pressure waveform section of the screen. Identify the plateau pressure and rest the cursor on this portion of the waveform. You will notice a numeric value to the right of the cursor. This is the transmembrane pressure of the balloon during inflation. Compare this value to the augmentation pressure, which is the aortic pressure during inflation. Ensure these two values are within plus or minus 25 millimeters of mercury. You may leave the cursor on the plateau pressure to continually assess pressure changes. A difference of greater than plus or minus 25 millimeters of mercury between the plateau pressure on the balloon pressure waveform and the augmentation pressure may indicate a malpositioned IAB and/or incorrect size of the balloon. Should the plateau pressure be greater than 25 millimeters of mercury as compared to the augmentation pressure, this may indicate the balloon is too occlusive. Obtain a chest X-ray to verify placement, as this could indicate an IAB that has migrated down in the aorta. If positioned too low, repositioning is recommended to the desired placement of 1 to 2 centimeters below the left subclavian artery. Reassess the occlusivity once repositioned. If the plateau remains greater than 25 millimeters of mercury higher than augmentation with proper placement of the IAB confirmed, reducing the balloon volume may be appropriate. A physician order may be necessary. Please follow your hospital guidelines. To decrease the volume, press the Volume tab on the action bar and decrease by half cc increments to the desired volume. Press Apply and Done once the pump has reset. Confirm the new volume as seen in the Volume tab on the action bar. Note: it is not recommended to remove more than 1/3 of the total IAB volume. Reassess the balloon pressure waveform plateau to ensure a difference of less than plus or minus 25 millimeters of mercury to the augmentation pressure.